What does an informed consent process look like for mirtazapine, otherwise known as Remeron? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I'm going through a series where each day I go through one of our commonly prescribed psychiatric medications and talk about how I do the informed consent process for that medication. So today we're going to talk about mirtazapine, otherwise known as Remeron. So mirtazapine is most commonly used for depression, but it can also be used off-label for anxiety and insomnia, as well as appetite stimulation. It acts on serotonin, but it does act on different serotonin receptors. So similar to bupropion, it's often used in conjunction with another antidepressant like an SSRI or SNRI. The most prominent side effects include drowsiness or sleepiness at the lower doses, as well as increased appetite. Weight gain can certainly be a risk with this one, so I don't tend to start it on patients who already have issues with their weight. As far as the drowsiness, at higher doses above 15 milligrams, it actually starts to be more activating, so it's less likely to cause this at the higher doses, but of course each individual's response is going to be different. Other side effects are going to be common to the other antidepressants, so things like headache, dizziness, dry mouth. It tends to be more gentle on the GI system than the other serotonergic antidepressants, but of course in some individuals they do experience GI upset. Just like the other antidepressants, the longer you take this medication, the more challenging it can be to get off. Withdrawal symptoms can look like essentially the opposite of the effect of the medication. So it can look like being really activated or anxious and having trouble sleeping. And sometimes itching can also be a common withdrawal effect. And of course, then I ask the patient, given all that we've discussed today, do you think that the benefits of this medication would outweigh the risks for you? And we would talk about their priorities and their goals as far as their mental health, of course. So that's mirtazapine. If there's another psychotropic medication that you want to hear an informed consent process on, then please share it in the comments below. Wishing you all good mental health, and I'll see you in the next one.